Does biopsy cause this cancer to spread? Is cancer surgery bad for cancer? Can you cure cancer just by using plant products? Does cancer always cause death? And so on. There is no end to confusion about cancer in general public. If these are not addressed, then each and every member of our society will be at danger because of such rumors will adversely affect you and me directly one day. It is in our own interest that such myths are dispelled and healthier society is born. The society which believes in transparent and genuine information on health. Today, we revisit a dozen of myths on cancer. First, does doing a biopsy spread cancer? Scientific evidence has conclusively shown that performing a planned biopsy does not lead to spread of cancer. Despite clear guidelines, many still believe cancer spreads through biopsy or needle use. Not only in India, citizens of developed countries can be a victim of such rumors. Recently, in Florida, USA, a book written by Dr. Ronald Wheeler started a major dispute even in today's modern society. The book asserts his ability to treat cancer without biopsies. The matter caused such a disruption that in 2017, the medical registration of Dr. Wheeler was cancelled. He was sentenced to imprisonment for spreading false information about biopsy. Biopsy is an essential part of modern cancer treatment. Many cancer specialists will agree that spreading such rumor is a nasty crime as it can harm patients directly and permanently. A good deal of cancer researchers have proved that biopsy does not spread cancer. A research study conducted in 2013 and published in the Journal of Endoscopy found no negative consequences for patients who underwent biopsy. That study examined 256 patients diagnosed with pancreatic cancer. In 2015, another publication in the journal Gut conducted research on 2,034 patients to determine the impact of biopsy. The findings revealed that biopsy does not increase the risk of death in cancer patients. One more research published in Urology Journal has proved beyond doubt that biopsy is a part of modern cancer treatment. There are no ends to such publications in medical journals. Overall, we must remember that biopsy is an integral part of modern cancer treatment and it is safe to have planned biopsy. Next myth, cancer spreads by touch. Cancer is definitely not contagious. I feel sad to see when relatives avoid visiting patients who have got cancer. In some clinics, people escape sitting by the side of cancer patients, perhaps in fear that touch can spread cancer. Overall, in modern India, bold people are coming out of such myth. However, in conversation with our patients, we still sense that many people mistakenly believe cancer is contagious. Yes, a total fabrication. Sometimes people argue some cancers are caused by infection. So, if some infections are contagious, then why cancer is not? We made a video on the infection-cancer relationship. The link is as below. In short, it is undeniable that 15 cancers out of 100 are caused by infections. For example, H. pylori bacteria from unwashed salad can cause stomach cancer, and cervical cancer is caused by HPV virus, which spreads via sexual activities. Liver cancers can be caused by untreated hepatitis infection. However, cancer does not spread by touch. Join for tea with a cancer patient, go on a holiday with them, go to movies together with no fear. And not only cancer, there is no risk of spreading the side effects of chemotherapy or radiation or cancer surgery. Myth number 3. We cannot prevent cancer. Numbers of cancer are increasing in leaps and bounds, but 30 to 50% of cancer, that is up to half of the cancers, are preventable. It is clear from the data from WHO. We have created a step-by-step video guide on how simple strategies can prevent cancer. Link is below. These steps are valuable and there is no cost or tablets involved. We just do not know about those very well because of lack of awareness. By all means, start those 10 preventive strategies today. Up next, cancer can be treated using mantras and amulets. Some people believe that cancer can be treated by chanting mantras, wearing amulets, or by local plant-based substances. There are a lot of researches going on for modern cancer treatment. Each day we are making new advances in cancer treatment, edging closer to conquering this disease. You need good quality surgeries and sometimes chemotherapy and radiation. Therefore, please refrain from wasting precious time considering the use of amulet or alternate herbal therapies. If you keep on using and rely on these unconventional therapies, you lose valuable time and the window to treat a real life patient. Coming up, microwave radiation can cause cancer. It is believed by some that using microwave for cooking can lead to development of cancer. This is completely baseless. Microwave uses waves which are classified as radiation, but you should not mix those with radiotherapy. Radiotherapy is when radiation treats cancer. Despite sounding similar, they are entirely different. Microwaves uses electromagnetic fields to heat foods by vibrating water molecules. Government regulations strictly govern how the microwaves are constructed, and researchers have definitely proven that microwaves do not emit cancer-causing radiation. Microwaves are widely used in our society. Microwave technology is used by television, wireless phones, sets, and even by the police to monitor overspeeding vehicles. All these microwaves are quite safe. Next myth: cancer always comes back. There is no scientific truth behind this. When I used to work in England, in clinic, sometimes patients used to say casually, "Oh, doctor, I almost forgot to tell you that I had colon cancer 20 years back. Now I'm fine." Maybe she was consulting me for some mild gynecological issues. Cancer is increasingly being regarded as a chronic condition, just like a blood pressure and diabetes problem. As science and medical science continue to advance, nations are making strides forward, and there is an increased number of early cancer diagnoses, and we can defeat the cancer faster. The chances of curing cancer are higher when it is detected early. It is important to raise awareness about early detection of cancer. Certainly, some difficult varieties can come back, but that is not the full story. Thousands of cancer patients are now continuing their life beyond successful treatment. So please do not suffer in unnecessary anxiety. Next, believing that natural alternative therapies can cure cancer. Individuals waste precious time seeking magical solutions through natural remedies or dietary treatments for cancer instead of pursuing effective medical therapy. Do you remember when Apple CEO Steve Jobs was diagnosed of having pancreatic cancer? He refused good quality surgery. Instead, he put his faith in magical treatment that focused on altering his dietary habits. In a CBS TV interview, Walter Isaacson, who was the biographer of Steve Jobs, said that in the last part of Steve Jobs' life, he regretted his decision of not having surgery at the right time, but it was too late by then. Let me assure you that there is no such clash between allopathic medication and Ayurvedic medication. Ayurveda completely is a different science. And just like Ayurveda, a lot of anti-cancer medicines in allopathy comes from plant sources. However, the way it is prepared before the patients consume it is a different level of study. However, taking direct plant products has not been adequately researched in multinational studies and not been published in peer-reviewed journals adequately. It can pose a significant problem for cancer patients as it wastes valuable time that could be used for the actual treatment. Worried American National Cancer Institute warned the public that thinking natural medicines do not have side effects or fully safe can be a major lethal trap for normal patients. Kava kava, a plant-based product, is sometimes used to ease stress and anxiety, but it can also lead to serious liver damage. St. John's wort is widely used herbal remedy for mild depression and insomnia. If someone takes that plant product, major anti-cancer treatment may not even work. It will stop working. Stay careful. Next myth: cancer always means death. Cancer is not a death sentence. The challenge of cancer is new to human civilization indeed, so science is taking time to find solution. As we keep researching and searching patients with cancer, some people might wrongly believe that cancer means certain death, but that is totally not true. There are researches are still going on. People are crushing cancer and living happily and healthily beyond that. Data from American National Cancer Institute suggests that in 2009, the number of cancer survivors in America itself crossed 1 crore 70 lakh. Yes, such a vast number of people are living by defeating the cancer today. Cancer Research UK data also suggests that a similar trend over the last 40 years. Living and surviving after cancer has doubled. If a country is well informed about cancer, the survival rates get better. It also suggests that since 1990, the outcome of breast, prostate and thyroid cancers has improved by over 90%. Unbelievable. Next, cancer surgery can spread cancer. If cancer surgery is done in a properly planned way, there is no evidence that it spreads cancer. Conversely, if surgery is not performed or delayed when needed, the cancer can spread more easily. Next, some people falsely believe that chemo always means permanent hair loss. It is not true either. A chemo can cause temporary hair loss, but most patients will gain back their hairs. There are very uncommon varieties of chemo which cause permanent hair loss, and there are umpteen numbers of chemo and targeted therapy which does not cause hair loss at all. Up next, one cannot have sex if you have got cancer. There are no valid reasons to believe that. In Kolkata, our patients with gynecological cancer can maintain a normal sexual life if they receive proper treatment and counseling. Besides physical challenges, cancer can also have mental issues such as stress and anxiety, which can affect sexual activities. However, if it is adequately addressed from very beginning, a patient, even after treatment, can have very normal sex life. Modern cancer treatments look after the quality of life issues of the patient in detail. Most patients can expect to have a normal sexual life. Next myth, the cancer patients cannot go to holidays. The belief that cancer patients cannot leave their home or go on vacations is false. Many of our patients frequently travel to visit Digha, Puri, Darjeeling. Some may go on holidays to London, New York and Rajasthan, and even to the Himalayas. One of our uterine cancer patient survivors traveled to an exotic destination and stood on top of a jeep just to send me a surprise picture. So don't worry about that. Next myth, cancer is always hereditary. As a matter of fact, only a minority of the cancer is hereditary. Perhaps confusion arises because you sometimes read and hear that cancers are genetic. Most of the cancers are genetic, but only a minority of the cancers are hereditary. There is a difference between being genetic and being hereditary. Important to remember that all genetic problems are not familial or hereditary. They do not run in families. Suppose you have a mole on the skin, which is of course a local gene issue. It is likely our next generation will not get it. So this mole is genetic problem but not hereditary. As the science is improving, it is making new discoveries to find more family cancer, but it is still a very small number. There is a happy paradox in this though. When we see such patients, or rather see such families with chances of family cancer, we notice their general health is much better than other members of the society. Ask why? Because they know their problems from their childhood. From young ages, they tune all their efforts to maintain their health in such a high quality standard that they can avoid having blood pressure problems, diabetes and many other cancers. Oncogenetics, onco means cancer and genetics means of course genetics. Oncogenetics is a new branch of science which tells our chances of having cancer in the future. If there are chances of developing cancer, then that person needs to have certain treatments and follow-ups and some tests. There are certain novel treatments which have got capacity to treat cancer even before the cancer starts. So rely on good quality scientific data instead of the myths and make our society a better place to live. That's all today. See you soon.